Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have with me a very special guest. I have with me Dr. Malini Khanna. She specializes in the non-surgical management of spine and sports injury. And she's been a practicing physician for more than 10 years in the South Jersey and Philadelphia area, local to me. And she specializes mainly in the lower back, hips, knees, and shoulders. She is passionate about providing non-surgical orthopedic care, and I am very excited to share her with you today. So welcome to the show.
Thank you. Thank you for having me. I'm really excited to be here.
Yeah, and I'm excited to talk to you. I have lots of questions for you, but maybe give us just a little bit of an introduction into how you got into non-surgical orthopedics and a little bit about yourself.
Sure. Like she said, I'm based out of the Philadelphia area. I was an athlete growing up. I was a gymnast. So with that came a lot of injuries. And that kind of led me into wanting to go into sports medicine. And then I realized orthopedics was a little too intense for what I wanted to do. So I felt like I found the non-surgical orthopedics to be my happy place, where I could provide sports medicine care, but not be aggressive about it. So I could provide the injections, I could help people with exercises, nutrition, just kind of be at their best to avoid those big surgeries. So that's how I got into this field. So
Yeah.
I'm a practicing, so my field is called physical medicine rehabilitation. So PM&R for short. And it's kind of it's been around for a long time, but not a lot of people are aware of what PM&R is, but it's up and coming. And the more that we get out there and talk about what we do, I think a lot of people will seek out our expertise.
Yeah, for sure. And, we were talking beforehand, but the runners and the athletes need you for sure. I guess selfishly, I wanted to ask you, what types of running injuries you commonly see, and then we can talk about some of the common treatments that you use. And I have questions about those too.
Sure, of course. So for runners, it's all overuse injuries. Obviously, running puts a lot of stress on all your joints and especially your spine. So I do see a lot of runners coming in with lower back pain. So I do offer injections for the lower back. So the epidurals, the facet blocks, the radiofrequency ablations, the SI joint. So that tends to be one of the big things. I do see a lot of spasming along the hamstring, along the IT band, and then that can lead into knee pain. So I do see a lot of trigger points is what we call them, is where the muscle spasms, and they basically are knots in the muscle. And so I can help release those with the techniques that I have learned. But those are kind of what I specialize in, is the spine, and then also the kind of the muscle and the tendon type of issues. Anything that, obviously we discussed this before, anything that requires any surgical management, I do refer out to orthopedics.
Yeah. I had during one of my running related injuries several years ago, I had a wonderful physical therapist, and he always would say, runners love to run. And so we definitely, it's very easy to get overuse injuries because that is our primary sport oftentimes. Even though many of us cross train and do other things and like other sports, primarily runners run, which
Absolutely.
is what leads to these problems.
Yes.
Can you talk a little bit? You told me about a couple of the treatments that you offer. One of them is PRP. Can you tell our listeners a little bit about that? Maybe, I'm not sure, some people may not have heard of it before. Other people may have said, oh yeah, I read an article about that. But tell us about it and how it could help.
Sure. So PRP stands for platelet-rich plasma therapy. So what it is where we take a sample of your blood, which is about 15, we take about 15 cc's, which might be like 3 or 4 of those tubes when you get your blood drawn. And then we take it, put it in a centrifuge, spin it down, And then the blood separates into plasma and platelets, which is really cool. And so the platelets usually come out yellow. So when we take the separate, we pull out the platelets, and then we re-inject it back into your body in the area that needs healing. Okay. So for instance, like a labral tear, if that's really the source of your pain in your hip, you can get labral tears in your shoulder or your hip, but obviously for running, you'll get it more in your hip. If the tear is really the source of the pain and it's just a small tear, the PRP, what it can do is we re-inject it back in, and the PRP has growth factors and stem cell-like properties. So it tries to go in and regenerate the tissue that's torn. The science behind it is still being developed. It's not 100% going to work, but it's a nice alternative to steroid injections. It's a nice alternative to surgery. Mm-hmm. And the promise in science the science is very promising that it does work. And I've had a lot of success stories with patients that did have labral tears or that had tendon issues. And then I performed this PRP on them and they got better. Mm-hmm. It is a little uncomfortable when you do the PRP because we're causing an inflammation. It's a pro-inflammation versus steroid, which is an anti-inflammation. Mm-hmm. So pro-inflammation. So the analogy I always give to my patients is that like I'm causing you pain on purpose. Like when you sprain your ankle swells and it's uncomfortable and it's sore for 2-3 days. You take pressure off of it and then your ankle gets better. So it's the same kind of concept I use when I'm doing the PRP. I'm actually trying to get your area to swell. I'm trying to get the area to feel uncomfortable. And then your body will bring blood flow to the area and then naturally try to heal it. So it's a really cool like concept. And I really do believe in the science behind it. And I'm excited to see kind of where the science takes us with this.
Do people often have relief with like one treatment, or is it like, can you do it multiple times?
Depends on the injury and the body part. So for tennis elbow, mm-hmm. it's usually like a one and done. So if someone has, and I have to catch it at the right time. So if someone is a big tennis player, maybe they're a runner and they play tennis as well. Mm-hmm. They might just need one treatment. The labral tears are a little bit more intense, like the chronic injuries that runners may experience. Those would be probably like 3 sessions.
Okay.
It's one at a time. I do one, see you back, see if you're seeing improvement. Mm-hmm. And I don't also want to do too many if you're not finding improvement. I don't find that to be, it's just a lot on your system to take the blood, to re-inject it, cause the inflammation, and to have to repeat it if you're not getting better. Yeah. I don't generally recommend repeating it unless, unless you are feeling better, but it does take time. It's not instant.
Yeah. Okay. And then one of the other things we were talking a little bit about, you had mentioned is trigger point injections. Can you talk a little bit about that? I didn't know beforehand we were chatting about dry needling versus wet needling, and I wasn't aware there was of the difference. So that would be helpful to know.
Yes, of course. So dry needling is basically doing the needling without any medicine. And then the wet needling is doing it with the medicine. So wet needling is with lidocaine. So I do more of the wet needling portion. So I put the lidocaine in the area. Usually it's a muscle knot, and I numb up the whole area. And then I take the needle and I actually jab at the muscle in 4 different quadrants to get the muscle to relax. So you don't feel it because you're numb. Yeah. But afterwards, you're not going to like me. You're going to feel pretty upset and pretty sore. And I do ask you to like rest for a couple of days, but then the muscle heals itself and feels better. So that's considered the wet needling. Dry needling can be done by physical therapists, acupuncturists, chiropractors. That's just where they take like a very fine needle, and sometimes they'll do the same kind of thing where they kind of irritate the muscle with the needle, mm-hmm. or they place multiple needles and let it sit in. And then even acupuncturists will put the needles in a certain meridian.
Right.
The physical therapist will put them kind of where your pain is, and then both can like attach it to electrostimulation. So it's kind of like tapping at the muscle and trying to get it to relax. Okay. So there are 2 different versions of doing it. So my technique tends to be deeper and more aggressive, mm-hmm. Just because of the fact that I can use ultrasound to get to the area.
Mhm.
of the tissue, and also because I can numb you up, so I can get really deep in there. So
Yeah.
I feel like
With all of the talk of needles, I'm like, okay, yes, the numbing sounds good. Yes.
yes, you definitely want to get numbed up if you are if you have like a very painful area, you do want to be numb.
Yeah, yeah. Now, when would you recommend, one of our runners or myself, when should we come and see you? Like if, in terms of, we're feeling something, maybe we've had a prior injury that we know about and is acting up. When would be a good time to seek you out?
Generally when you're symptomatic. So
Okay.
if your hip pain is not bothering you, or whatever hamstring issue you're having, or not you specifically, any
Yes,
runner,
I know.
just when you're symptomatic, because that's when I can really target the treatment.
Mhm.
If you're not having symptoms, then there's no need to come in unless you want like a just kind of a general overview and let me like take a look at your strength, make sure you're balanced, um, and also just to kind of feel around and make sure you're not building up those muscle knots, because it's so common to get them in the IT band and the hamstring.
Mhm.
So if you feel like one side is lopsided, like tight, a lot of times it could be a trigger point starting to form. So
Mhm.
if you're starting to notice something that's off, then I would recommend you come in and I can take a look.
Okay. Okay. Now, oh, and tell everyone where they can find you.
Sure. So I just started my own practice in the Navy Yard in Philadelphia. I'm,
Woohoo.
yay! I've partnered up with the Vincera Institute. So they're well known for core muscle injuries, and they do surgery, and I am non-surgical. So we're working well together. And the best place to find me is on on my website, www.cssmpa.com. So that stands for Concierge Spine and Sports Medicine Pennsylvania.com. And I have all my links to my social media on the website.
And I will also leave them below as well. So everybody can find you on social media and your website.
Thank you.
Yeah, well, thank you so much for joining us and giving us a little bit of a glimpse into all of this. I know there's a lot more that we could go into. Well, thank you all for listening, and we will talk to you soon. Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.